and the right to act. So my interests are in this health impact assessment side of things. And this is to identify potential health consequences from a proposal. So when I saw that coal bed methane and potentially fracking could come to the area, I thought, well, I must go along and have a look at what's in the government papers, must go along and have a look at what the NHS has collected, both in the UK and in Scotland. They must surely have tried to work out what the health impacts might be of these particular activities. And I found nothing. Absolutely nothing, and I'll come back to this point in a moment. But what I've put up here is a copy of a health impact assessment done by a health authority and a local authority of a few hundred people in Colorado. So before they started to develop unconventional gas, they said, let's look at what the problems are. And I've actually got their full report here. Their researchers are really helpful. It's a 157-page report detailing what the health, physical, the health, mental health problems might be, and what the social benefits and the social costs are. So that's a good health impact assessment. Now, I probably ought to say that I'm sure there's a lot more paper available, but in the UK, for the planning proposals, you're initially required to produce an environmental statement. This is the one for this area, the Falkirk area, which has got the health bits in it. And it basically says, could be some air pollution, but we've got it under control. There could be some water pollution, but we've got it under control. The big issue was probably dust and noisy lorries. And that was it. Now, obviously, a lot more information has been made available since. But I think what communities should be looking for are proper, detailed health impact assessments, like the Colorado one. And why should they be doing that? Because there are particular threats in communities. And again, you may not be able to see the detail at the back, but this is the Scottish Index for Multiple Deprivation in 2012 for your area, with Alloa in the middle. And what it's saying is that, in fact, within Alloa and within the region, there are a lot of the most deprived areas, and there are very few least deprived. And what a surprise to find that these industries come along and they try and shove the developments in areas where there are most problems in terms of health. That's the thing that interests me. Of course, there may be other issues about unemployment and people may see benefits, and that's something to take seriously. But if we're looking at the health of the Alloa area, what we see are major problems. In fact, the position in some of these areas in terms of deprivation is getting worse, not better. That's overall deprivation, so that would be income, employment, as well as health. And people have said, the Scottish Government set up inquiries in 2005, it said that people in the most deprived areas are far more likely to be living near to pollution sources of potential negative environmental impact than people elsewhere. And people living in the most deprived areas are more likely to experience the poorest air quality than those living in less deprived areas. And they talk about the particulate matter and so on, things that come out of diesel, and if you're thinking about what's going to be going in and out of a frack site, one hell of a lot of water, one hell of a lot of equipment, one hell of a lot of diesel. So it's not necessarily the noise of the lorries that's an issue, although that certainly could be. It's the other things that they're producing as well. So good news in Clacks is that from a health point of view, there has been a reduction in some of the questions of ill health. The bad news is that 14 of the Clack manager data zones, which are 500 to 1,000 households each, fall in the 15% most deprived areas in Scotland. So we need to, when we look at these developments, also look at the communities where they're going to be located. And I think that's where we need some key principles. And the World Health Organization, over 25 years ago, laid these down. And I think, again, they're ones that one should be asking the NHS in Scotland, local councillors, MSPs and so on, as to what extent they're following them through. And this is that every individual is entitled to an environment conducive to the highest level of health and well-being. That the principles for public policy should be prevention rather than cure, bearing in mind 20, 30, 40 years for a disease to develop. Best new technology should be used, low impact technologies should be used. So if you look at that in detail, if you're thinking of the UK, Scotland is probably better than the UK. But if you look at it in detail, there are problems about every individual getting the best levels of health in the context of the environment. There are problems about public authorities resolving problems of environment and health, and the situation is likely to get worse. So we could go down the charter and we can see real issues there in terms of what goes on. Won't go into those in detail. There are strategic elements that should apply there as well in terms of prevention and supporting the technologies and assessing the problems. And they should be enforced as well as being enforceable. So that's another thing. You're told there'll be fantastic regulation, good industry practice. What's the record? Well, it's not that good, unfortunately. And if we looked at regulation of fracking, when the big inquiry was going on with DART, there were people producing reports, mainstream academic geologists, highly respected by industry, saying that when they looked at all the wells in the past onshore that had been drilled, there were some that nobody had any responsibility for, and that there were problems there with potential leaks. There were problems with poor monitoring as well. So you need to think about, bear in mind the coal industry and the problems we still have because of the coal industry, and open cast mining and the problems we still have, and companies walking away. There are issues about what you'll be left with. In this context then, you'd expect the regulators to be picking this up, and the health and safety executives, the one at the point of production that deals with the workers, but also then is setting standards that may affect the communities. And they say we should adopt the precautionary principle. If in doubt, don't. But they've then gone on and said, well, actually, what we want is good regulation, which they mean, by that they mean better regulation. By that they mean smart or soft regulation. By that, de facto, they mean less regulation or deregulation. So on the one hand, they're saying we want regulation. On the other hand, they're saying, well, we've got to be proportional and consistent. Nobody wants pointless regulations enforced, but you do want regulations that protect public health enforced. So you can have a look at what they're doing, and they're saying, well, actually, our role is really as a catalyst, not as an enforcer, not as a regulator. We go around and we'll try and help people do things. Well, when you look at the record of some of these industries, I think that's profoundly worrying if you're going to see coal bed methane and fracking going on. They don't really talk about the precautionary principle. If we look at what industry has done, this is a book written by the guy who's a leading environmental researcher, environmental health researcher in the US, now heads a major government agency appointed by Obama. And he said industry goes around casting doubt on research so that nobody takes action, so that the regulators pull back. And he said there's good evidence, usually, for taking action and taking action early. The paraffin cases I mentioned at the beginning, think of those. So with benzene, which may be produced naturally through fracking and unconventional gas, you find that in 1948, the industry itself had an institute that was saying, well, this is a real problem, there could be chronic exposure, we don't believe you can have a safe concentration for this. Then immediately after that, they started saying, well, we don't want to regulate benzene closely. And if you look at what's going on in the HSE, the standards in the UK for controlling the benzene at the point of production have always been extremely poor. They've been a lot lower, a lot worse than those in the US. And the American Public Health Association, we don't have an equivalent here for that, was saying we want to take action. And not only were they saying that benzene can cause cancer, which they knew in 1948, they then started to discover that it could cause cancer at much lower levels than thought. And then, these are some of the really significant things to bear in mind if you get extremely low-level exposure in communities. They then said benzene crosses the placenta and is